Hi, hope you're all doing fine. So while referring dental materials or while you're studying dental materials, make sure that you follow these standard textbooks like Phillips and Craig, right? So when you're starting with Phillips, right, so you have these basic key terms at the beginning of each chapter. Try to focus on them as well, because you have the luxury of not by hearting them now, right? So in undergraduation, for university exam sake, we used to by heart them, most of us, right? So that we can replicate the same in exam, but now we have that freedom not to by heart them, so that we can understand them now, right? So our focus now should be on understanding the terms, because in exam the testing will be more on our understanding of concept rather than our memory, right? So it's sometimes both memory as well as understanding, but in key terms, once you understand what that particular term is, then the concept will become much more easy and clear, right? So try to focus on those key terms, need not by heart them, but try to understand the meaning and then proceed with the multiple choice questions as well as a synopsis. And for sake of reference, in case you have any query or doubt or ambiguity, then you can refer these standard textbooks, either Phillips or Craig. And also we have one book called S. Mahalakshmi, Materials in Dentistry, Materials Used in Dentistry by S. Mahalakshmi. Even that's a very good book for sake of reference, right? So in this video, let's focus on various important topics based on their frequency of repetition in the last 3 to 4 years, right? So starting with the first chapter, in the sense from properties of dental materials, we can focus on the following topics. The coefficient of dermal expansion, a question was asked on this in Karnataka 2013. Vickers hardness number in PGI 2011, elastic strain in Karnataka 2013. We have various questions on contact angle, wetting, wettability from these areas, right? In Karnataka 2013 as well as in AAPG 2015. And also we have questions on latent heat of vaporization in AIMS 2013. And question on creep in MSET 2014, question on compressive strain in AIMS 2014, question on ductility in AAPG 2015, a question on stiffness in AIMS 2015, and a question on Bizold-Brook effect in APPG 2016, right? So these are some of the important topics which you can focus on in properties of dental materials, right? And now coming to impression materials. As such, in impression materials, you need to focus on the classification of impression materials, and also for a given impression material, its setting mechanism, its basic composition, and the functions of individual components in that material, and also various factors which modify the setting time as well as setting expansion, if any, right? So these are the areas which we need to focus on while we are preparing for impression materials, right? So coming to the important topics, we have several questions on elastomeric impressions, right? So we have one question on a 2-in-1 stage impression material in AP 2013. We have a question on alginate fillers. So alginate, the composition, the importance of fillers, the setting mechanism, the temperature of water that's needed for manipulation of alginate, the water powder ratio, chrome alginate. So we have various important areas in alginate to focus on, right? So I have questions on alginate fillers in AIMS 2013, and also we have questions on addition silicone in AIMS 2013, and also a question on setting time of polysulfide in AP 2014, and also we have questions on controlling setting time of alginate, right, in COMET 2016 as well as in MSET 2014, and also a question on example of reversible impression material asked in COMET 14. It's nothing but impression compound. So it's based on the classification of materials, right? So you need to focus on the classification as well. And also we have these questions on the ascending and descending orders of the permanent deformation potential of various elastomeric impressions, right? And also a question on shelf life of elastomers in AIMS 2014, a question on type 1 impression compound, and a question on chromalginate. We have this particular question asking the component of hydrocolloid that can lead to fixed drug eruptions. These drug eruptions are nothing but cutaneous reactions which are seen because of repeated exposure to a specific chemical. It can be either a drug or any other chemical. So a component in hydrocolloid that causes these kind of fixed drug eruptions or phenolphthalein, it's present in chromalginate. It's responsible for color, right? And also we have various agents which are responsible for color of alginate, such as cresol thymol red and also thymol blue, right? So we need to focus on the latest aspects pertaining to alginate as well. And then we have a question on condensation reaction asked in AIMS 2014, and also these common questions, stock questions we can consider. The effect of gloves, sulfur contamination on the setting mechanism of addition silicon, right? Asked in Comet 2015. And a question on reversible hydrocolloids asked in Kerala 2016. And also the cast pouring timing, because for example in case of polyether polysulfide or in case of any other elastomeric impression, the cast pouring time varies. For few impression materials we need to pour cast immediately, whereas for few other materials we need to delay cast pouring because of several factors, right? So these topics, I mean these questions are being repeatedly asked in various entrance exams like Kerala 16, AIMS 2013, etc., right? And also recommended water temperature for mixing alginate asked in Comet 2016, right? So these are some of the areas which you need to focus on while you're preparing in impression materials, right? And coming to gypsum products. So gypsum products, the moment we hear of this, we need to focus on classification, the water powder ratio, factors affecting setting expansion, and also factors affecting, I mean, the basic constituents in the composition of gypsum products. It's the way in which it's being fabricated, like calcination process, etc., right? So these are some of the areas where we need to focus and stress upon. So coming to, in specific, the topics from gypsum products, we have questions on water powder ratio asked in AIMS 2014. We have questions on factors affecting the setting time asked in GSET 2014, and also various tests for assessing the setting time, right? Asked in AIMS 2013, and factors affecting setting expansion of plaster products asked in PGI 2014, and questions on dye materials, different types of materials that can be used as dyes, right? So asked in PGI 2014, and factors affecting the hardness of stone asked in AIMS 2015, and classification of gypsum products. We have a question from this in Kerala 2016, and a calcination procedure, calcination procedure. We have one question from this names 2014 as well, right? So this is pertaining to gypsum products. And coming to restorative resins, right? So we have questions on chemically activated resins and the residual monomer content within these resins asked in PGI 2013. We have questions on polymethyl methacrylate asked in Karnataka 2013, and also polymerization process of resins asked in AIMS 2012, and a few questions on syneresis and also plasticizers used in resin asked in AIMS 2014. And we have several questions on ADS specification numbers. ADS specification number for amalgam, for plaster, for water-based cement. So we need to focus on ADS specification numbers also. So make a note of all ADS specification numbers separately in your notes so that you can memorize them, and you can easily memorize them, and you can revise them just before exam with ease, right? So make a note of all ADS specification numbers. And we have questions on ADS specification number 12 for dough forming time in case of polymerization, and ADS specification number 13 for chemically activated resins for repairing denture-based materials asked in APPG 15 and 16 respectively, and also monomer polymer ratio in chemical resins, chemically activated resins asked in AIMS 2015, and composition of monomer and polymer asked in AIMS 2014, right? So these are some of the questions in restorative resins. And apart from this, in restorative resins we'll also have several questions from composites and also on bonding agents, and we also have questions on etching time, the depth of etching, etc., right? So we need to focus on those aspects as well. That is a mechanism of adhesion, etching agents, bonding agents, generations, etc. And in amalgam, we have questions on AIMS technique asked in MSET 14, tarnish and corrosion asked in AP 2014, the setting reaction, whether it's a soluble kind of reaction or precipitation kind of reaction. We have a question from this in AAPG 2015, and a question on ADS specification number for amalgam asked in Comet 2016, and the meaning of amalgam, right? So what's the basic meaning of amalgam asked in Kerala 2016, and also we have a question on mercury toxicity asked in APPG 2016. And coming to metallurgy, we have questions on linear coefficient of thermal expansion of metals in metal ceramic asked in Comet 2013. We have questions on annealing asked in AIMS 2012. Questions on, we have several questions from investment materials, the basic composition of investment material, the classification of these materials, different types we have, and different processes which are used for casting using these investment materials. So we need to focus on investment materials as well, and we have questions from these investment materials in AP 2013 and PGI 2014. And also we have questions on stainless steel, its composition and the importance of chromium, asked in AIMS 2013. And biocompatibility of casting alloys, we have a question on biocompatibility. Also various tests for biocompatibility, etc., asked in COMET 2014. And properties of soldering material, asked in GSET 2014. Various anti-flux materials used in dentistry, asked in AP-PG 2014. Casting shrinkage, asked in COMET 2015. And various casting defects, that's very important. Various casting defects, the classification and the mechanism why we have a particular casting defect. And we have also questions on carbon steel, asked in AAPG 2015, austenitic carbon steel, martensitic carbon steel, and ferritic, right? We have different types of carbon steel, so we have questions on carbon steel as well. And coming to direct filling gold, so in case of direct filling gold, we need to focus on the basic properties of gold, that's very important, and also the purity of gold, the fineness of gold, or gold when it's measured in carats, right? So we need to understand the conversion. And we have questions on fineness of gold in AAPG 2015, classification of direct filling gold, asked in AAPG 2011, and also desorbing, degassing or desorbing, asked in APPG 2015, and various synonyms of matte gold, asked in AAPG 2014, and also different forms of gold, pure and impure, cohesive and non-cohesive gold. We have a question from this in Karnataka 2013, right? And coming to dental cements, so cements as such, we need to focus again on the basic composition of powder, liquid, setting mechanism, setting time, mixing time, various properties affecting the setting mechanism and their mechanism of adhesion. So we need to focus on different areas, and also area specification numbers wherever necessary. And coming to cements, to be in specific, we have questions on GIC, the composition of GIC, its mechanism of adhesion, various classification, fluoride recharge. So we have wide array of questions from GIC. So GIC adhesion mechanisms, we have question from it in AIMS 2012. Also we have questions on indications of GIC, asked in AP 2014, and fluoride recharge of GIC, asked in Kerala 2016. And also we have question on most irritating cement, I mean the cement which is most irritating to pulp, asked in COMET 2013. And also we have questions on pulp protecting agents, asked in GSET 2014. Zinc oxide eugenol indications, asked in PGA 2011. Zinc phosphate advantages, asked in NEET 2013, right? So we have a wide range of questions from dental cements, right? It's also the most important topic. And coming to dental ceramics, we have different questions like the basic composition of ceramics, their important individual constituents and their functions, and different types of ceramics we have in market, and also advantages and disadvantages of porcelain, asked in COMET 2014. Firing of porcelain, I mean air firing and vacuum firing, right? So asked in GSET 2014. Classification of ceramics, asked in AAPG 2014. And dispersion strengthening, asked in PGI 2014, and etching of porcelain, asked in PGI 2013, and methods to strengthen ceramic restoration, asked in PGI 2014. And as I said, the composition, the function or the importance of metal oxides in porcelain. And also we have questions on various miscellaneous topics like FDA classification of various devices used in dentistry based on their risk potential. And also we have questions on tests in biocompatibility, asked in AIMS 2014. And for this biocompatibility, you can refer S. Mahalakshmi textbook on dental materials. I mean the material, the information given regarding biocompatibility and various tests is extremely good, and it's very interesting also. And also we have questions on various abrasives, their origin, their source, like whether they are of natural or synthetic, and also various classification or types of abrasives and particle size of air abrasive particles like alumina particles, etc. Right? So we have this wide range of questions from abrasives even in AIMS 2014, PGA 2013, and COMET 2016. Right? So these are some of the important topics in dental materials. It's a very extensive, very huge, and very vast topic or subject in dentistry, and for that matter, matter, it forms the basis on which the entire dentistry lies, right? Because there is no branch or specialty where we don't use dental materials, more or less, right? So these topics, the subject per se is very much significant. That's why even in our online course we have allotted around 2 weeks time, on contrary to the 1 week time which we allot usually for other subjects, right? So we have 2 weeks time for this subject, and you will have ample time to focus on. And also keep in mind that refer a standard textbook. If in case you are referring any particular information, make sure that you refer a standard textbook, either Phillips or Craig, and that too a recent edition if possible, right? So these are some of the important topics. Hope it's clear. Make a note of all these topics and prepare accordingly. And also we have devised a syllabus which is in accordance to DCI 2007 regulations. You can mail us if you want to have a look at that syllabus also, right? All the best.